All right. So today what we're going to talk about is phased opening. All right. So what phased opening for our medical center, what it means is that we're not going to open up the VA center, including the SCI center, as if it was before COVID. Like, hey, make an appointment, come and see us. All right. Our phase opening is going to happen in 3 phases. All right. Phase 1, phase 2, and phase 3. Phase 1 actually means that we're going to run not more than 25% capacity. Now we're talking about outpatient, okay? Inpatient, we will constantly be very selective on who we admit on inpatient and decide on the acuteness and the necessity for inpatient, okay? So we're talking about mainly outpatient here, all right? So what does this phase 1 look like? Phase 1 actually has 2 parts, phase 1A and phase 1B, all right? Phase 1A is what we've been doing all this time, all right? Being very selective, only seeing people face to face when it's absolutely necessary, like urgent or emergent cases. And you guys interrupt anytime for questions and stuff, all right? Don't let me just keep going. So that will be what have been happening now. So if Scott says, hey, doc, I need to come and see you, first thing we would do is set you up with VVC or phone appointment. All right, and check with you. Hey, Scott, what's happening, all that. And then we determine that, hey, you're going to be okay. I can take care of this through video. We're going to do this and that. Done. Okay. Now, in phase 1A, which is the current status, it will be more like if Scott calls and I do the VVC and find out, okay, you know what, Scott, I can't help you without me really physically looking at you, touching you, doing things. But I think you can still wait till another 1 month or so. All right. So don't come in. Okay. Still phase 1. We just did a VVC. I determined that you don't need to come and see me, but it is something that I probably need to see you in about a month or 2. Okay. Another scenario will be I look at Scott and say, okay, this does not look good. I do need to see you because if I don't see you right away, within a week or so, you're going to go downhill. Okay. That's what phase 1A is. We're bringing in for any urgent or emergent cases. And that's happening in all VA, within our VA system.
So let me ask a question, Dr. Lee, right on that subject. So if I have a history of UTIs, and it's already documented and it's in my file, and I think I have one, can I call my primary and get an antibiotic without coming in?
So that is up to individual provider, how they look at you. So it's case by case. I will be going through all the history with you, your symptoms, and it's the comfort level of that provider to determine whether you need to drop a sample off to me or I can treat you via VVC. Okay? So everyone will make their own decision. The scenario that you brought up, chances are almost 99% chance that it can be done through VVC.
Great.
Okay.
Great.
So that was a good actually scenario. So that's what's been happening. It's just urgent and emergent cares. Okay. So when we say we're going to phase 1, 25% cap, we're actually not doing anything different than what we're doing now. All right. So that means actually, you know what? I can see you if I need to see you. Yeah, it still needs to be an urgent kind of thing to see you for, face to face. We're going to still push VVC and everything else because we are not at 25% from SCI standpoint, but other department may be, right? But they have to cap it at that. Okay, this is again face to face. So phase 1 opening from spinal cord injury standpoint, there isn't a whole lot of changes. It's that what we're doing right now. Okay, so everybody should be prepared that this is going to go on for at least June 1st is when the VA is going into a phase opening, phase A. Okay, phase 1, I mean. So what we're going to stay to do is keep it as is. We're going to push VVC. We're going to push phone. And if we're going to see you face to face, it will be for urgent cases or cases that cannot wait for another 2 weeks or 1 month. Okay. So if I see you guys, if I see Kevin VVC and says, okay, this case can wait another month, you're not going to be scheduled to come and see face-to-face. Got it? All right. So that's phase one. And that can go maybe 2 weeks, maybe 4 weeks, a month, or it can even go up to 6 weeks. All right. And that will all depend on if there's a surge or not and things like that. Sound good? All right. So what does phase two mean? That's like, hey, go to 50% capacity. When we're easing in, we're doing okay. Start seeing people face-to-face if needed, and bring in people, those that needed to push back for a month or so. Let's bring them in if you need to see them. So I'll use this case scenario. I saw Scott VVC and said, hey, Scott, you know what? You're going to be okay. Here's a medication, or here's something else, but I don't need to see you. We're going to push you back off to 1 month because I think this could wait till another month. All right. And then that month comes and say, we're going to open up to phase two. All right, let me go check with Scott. Hey, Scott, how you doing? We do VVC and say, okay, it's been a month. You know, hey, doc, you said you're going to come and see me, or I can come and see you. But okay, let's go over with your symptoms, your issues, what's going on. Then I determine, okay, Scott, actually, it's not too bad as I thought. So I'm going to push you back another month or two. Okay. But if I see, okay, I do need to see you. So I'm going to have our clinic schedule you to come and see me. All right. So it's constant fluid kind of system right now, but we're going to be opening it slowly like that, but it's going to be a constant virtual visits at every turn. So
on phase two, will you be clearing out all those that you have been contacting, all those that you pushed off all this last couple months?
Yes. So that's the plan. What we've seen so far from our clinic is that those people who've been pushing off, the providers, case managers have already been in contact. So it's not something that it seems like I need to push. It looks like people are already doing that. But if it's necessary, of course, we'll be doing that to say, hey, how are you guys doing? I did push you off for a month. So we're going to have to revisit all that through the virtual. Okay. And majority of the time, I do see people contacting us, your members contacting us saying, hey, you know, should I come and see you? I got this thing. I talked to you last time. So there's a follow-up, and then they're doing things. Because we have to prepare for new norm. This may be the new norm. The virtual may be the way to go 90% of the time, versus in the night before, 90% of the time people came in.
Right.
Okay? So we're kind of slowly phasing into that new norm. All right, any questions on phase two? It's almost similar to phase one from spinal cord standpoint. We have the option to push back or continue with VVC.
So I almost want to say for any prosthetic needs that have to be fitted, or in my case, for my Bioness unit, it has to be the computer input is needed.
Wow. That was bad.
Yeah, I think we're getting feedback from Dale. I think, Dale, you're on video and phone. You got to disconnect.
Mute your phone.
There we go. That's better.
You just hung up. I said to mute it, not hang up. Okay.
So like for prosthetics that need to be calibrated and fitted to the individual. So is that more of this phase two that you're describing?
So again, don't get hung up on the phase and what it does. Get into the mode of, okay, it's phase two. This is wasn't urgent or anything. I wasn't dying because of this thing, but I want to know if I can be seen because we're in a phase two. Say you call, okay? And the doctor says, okay, so it needs an adjustment. Looks like you're having a real hard time. Let me see if we can get the prosthetics to do this virtually or not. We don't know. So they will be contacting you and try to do virtually. PTOT will try to do virtually. And if that fails, then they'll determine, okay, Scott, with your FES system, I think we can wait. I don't think we need to do anything right now face to face. It may be slightly uncomfortable, but let's wait until phase three. All right. So that may be happening. Or they may say, you know what, I don't want to wait on this thing. Scott, I need you to come in. So that will be decisions made at that time. Okay, so every phase we're going to be triaging and looking at to see if we do need for you to come in or not. This phase opening doesn't really affect SCI quite a bit as much as the other part of the center, because we're not going to have mass influx of you guys coming in, you know, because our schedules already, even before COVID, we were pretty staggered out. So we're going to be fine, but we still have to practice the virtual medicine as much as we can, because phase 1, phase 2, phase 3, we're not going to be doing the practice as what we have done in the past, where we're automatically scheduling you guys face to face. More of the automatic will be the virtual setup, and then face to face will be more of the exception now. Before it was the reverse. Okay. Again, every provider will make that decision that I do need to see this person, and we're going to see him if we need to see him. Right.
Yeah.
Now,
Over the weekend, I had a major problem. You know, I had a UTI and I kept putting it off.
mm-hmm.
And Sunday, I was just in so much pain. I wound up going to the emergency room.
Mm-hmm.
But I think that was a problem, you know, trying to put it off, trying to keep it from going to the hospital. You know, I was kind of afraid of that.
Sure. So in your case, Pete, you know, if the symptom initially started on the weekend, it may be better for you to just go to the ER to prevent it from getting worse, unless you figured out how to clear it. But let's say your symptoms started on Wednesday. Don't be hesitant to call the SCI, your triage nurse or the doctor, so they can actually deal with it right away through VVC. And again, if they feel VVC wasn't enough, they will bring you in if it's an urgent case.
Well, it started late Friday, and it was
so
like
then the ER was the right place to go.
Right. Yeah, I called the nurse line, got all set up. I got there, they sent me right into a room.
Mm-hmm.
You know, I wasn't in that waiting room for more than 5 minutes.
Yeah, they're processing people quick to avoid a lot of things.
And so they have it set up real nice, you know, positive airflow, so everything flows into the room, and then they close the door, and you know, it was an experience.
Right. So for all your members, they should not be waiting to get really sick to do things, you know. And if you're sick, don't wait. Go to ER. The people are there. If you're sick and we're still open, call us so we can advise you guys what needs to be done, or even do the treatment right over the VVC.
Yeah, waiting was like the really wrong thing to do. But, you know, I was really worried about going there. You know, from what we've been saying, it's like a hell on wheels there kind of thing.
It is good to think about, you know, if you don't need to come in, don't come to ER. But in your case, you had to. There was no. So you made the right decision to come in.
Right.
Okay. But for small things, you know, when typically people used to go to ER, that's not recommended anymore. All right. All right. It's a good question. So what does phase 3 mean? That means we can go up to 75% capacity of face-to-face. Again, I'm not too concerned about how our SCI is, but we are going to be practicing new at that time. Phase 3 basically means we're still going to push VVC and virtual things as heavy as we can, phone triage, phone medicine as much as we can. And then as things happen, we will be actually seeing you guys as needed. So annual exam process will change. How often do we do face-to-face annual exam versus how much do we do virtual? We have to figure all this out. This is all new to everyone, remember? So we will have to come up with some plan as to, you know, what does a face-to-face annual exam entail, and what does virtual annual exam entail, and who gets to do the virtual annual exam, who absolutely need to do the regular annual exam. We haven't figured 100% of that because we're looking at all our patients and individualizing everybody in that fashion. So this is all learning for me, our provider, and for you guys.
So with the delayed or the phased annual exams, should we pick back up the responsibility of sending out the grab-and-go bags and the red dog tags?
I would hold off on that until we get a clear process ourselves. So things will happen. Now the annual exam is going to happen, whether it's going to be virtual or face-to-face. That's the question, guys. Okay. Annually, we're still going to see you, but what's the best format for each individual person? Like Cody may be different than how we do Troy. We may be different to how we do Dale and all that. We want to make sure it works for everyone, not clump them all into a group.
Well, Dr. Lee, Dale Nelson speaking. If we're going to be having our annual exams virtually and we haven't got a grab and go bag, will the hospital send it out, or how would we proceed with that?
Okay, so again, those are the stuff we have to figure out. We haven't figured those things out because right now we're trying to figure out the process of at least getting the annual exams done.
Well, I understand. I'm just trying to see if there's a place that we can help out.
Yeah, and we will be reaching out to you guys in those kind of areas because we're going to need your help.
Okay, so.
And we'll figure that one out. And then right now, obviously, you guys can't even come to pick up anything, to do anything with it because it's such a restricted lockdown, right? But as phase opening happens, there will be time to say, hey, Dale, can you bring somebody over and pick up all this thing since we decided we're going to do ABC with these bags, right? So, but it's something to think about as we keep opening up, you know, and then we'll take your suggestions too.
Hey, Cody Becker here, Dr. Lee.
Yeah.
What do you guys plan on doing with the annual exams if you guys do virtual? How do you guys plan on doing anything as far as ultrasounds or anything like that?
Correct. So those are all the factors to figure out. So what is the new norm? Does the ultrasound, even though there's a pre-COVID, there's a recommendation how often you do ultrasound, how often you do CT, right? How often you do labs, right? So post-COVID, from lessons learned and stuff, do we need to do this thing every year or not? Or if we're doing a face-to-face, is it just so you come and just get the ultrasound done and get out of here so you're not hanging around in the hospital?
Right.
We don't know the process yet, but we do know we can't go 100% virtual for everything. It just won't work, right?
Right.
I know just a face-to-face like this and maybe just checking your elbow and things like that we can do through a video. But when it comes to certain things, like if the lab is the only thing that's missing that out of the entire virtual exam, that may need to be sent near your home to get it done instead of traveling all the way here. I just don't know those answers yet. And honest truth, you know, annual exam, maybe we'll do every other year face and every other year virtual. All right. And can we skip the lab for that virtual time? But that, again, is individualized.
Is it going to affect our medications?
No, obviously not. If you guys need them, we're going to continue. But we need to still connect in order for me to keep giving you the medication and stuff, right?
Correct.
And virtual may be the best way to do the connection for that time frame. So your care, guys, will not stop, all right? It's just new. We're going to have to find a new way of doing it to prevent you guys congregating in the clinic. So many times there's, we will be planning in where, you know, before, let's say Dale, Troy, and Cody, you know, you used to come in, we would schedule you 30 minutes apart. The new process may be, Dale, I'm only scheduling you at 9 o'clock. Troy, you can come at 10. You're spacing you guys out, all right? And also, you know, Troy comes in 2 hours ahead of time saying, hey, you know what, I'm here early, so I'm just gonna hang around here or there. Answer is no, Troy. You're going back out, go to McDonald's and then wait. You can't come in half an hour earlier than that. These are new processes already being looked at. And that will be something, once it's finalized, I'll be sharing with you guys that, hey, you know, your members need to know they cannot come here 2 hours early and hang around. They will be sent back out, winter or not.
But they could, Dr. Lee, they could sit there in the parking lot and wait for their time up, right?
Correct, yeah. McDonald's was just a luxury, yeah. So yes, but the process is, how do we minimize crowding within the clinic, in the hospital, right? Like anywhere else. So we cannot have a bunch of people come in and just wait inside the building. So we want to stagger people. We also want to make sure people don't come too early. Because, you know, guys, in the past, I love having you guys come early, chit chat and do things. Those days are gone now. So it has to be very strict. So you
I have
guys
a question.
Zoom stuff.
Sorry.
Go ahead.
You know, the people who come in like me and do patient visits, what's going to happen with that?
So, okay, new rules will come out. We don't know yet what that will be. Like even Robert coming in as an NSO, there'll be more strict rules coming out, some do's and don'ts. So same with Pete, your role as a PVA officer, right? Coming in and out. There'll be new rules coming out. I don't know what those are yet. Because you guys are one chapter. We got a million other VSOs, right? With the same kind of role. So we have to figure all that out. Yeah. I'm assuming that a lot of it will be virtual for you too, but also there'll be time for you to come in as well.
Yeah, you know, because a lot of those guys, you know, depend on us to come and visit for a while and just sit and talk.
Yeah, absolutely. But this may change. It's going to be one of those things we have to see and accept the new changes. Hopefully some of them could still be in process, in play. All right. But as soon as I know, I'll be discussing it with you guys. All right. Because we know this is an important part of a veteran's life and inpatient. All right. Good question.
You know, some of those guys sit up there for months at a time and have no visitors, and you know, they don't have any contact at all with anybody, and they, you know, they just love to talk to somebody about anything. You know? And
again, you know, physical contact may come, but it will most likely be, majority will be virtual. So let's say, you know, if Scott is inpatient, all right, and he hasn't had any contact and was still not allowed to have contact or minimal contact, we will be help setting him up with an iPad and you to do virtual talk.
There's an awesome app for that. It's called House Party. You guys can play games. There's all kinds of stuff on there, and I'm pretty sure you can have like up to 60 people in a virtual party. I do it with my family. Yeah, House Party. Yep.
Okay.
I do it with my family all the time because we don't have visitors up here. I got a 9-month-old baby here, and just can't risk, you know, having him get sick. My wife has to go to work, so that's already a risk as it is.
Sure.
But House Party is a great app. Great app.
So Pete, that's those are the stuff you should study up on, because I can pretty much guarantee you that it's not going to be business as usual like in the past. It's going to be saying, hey, Pete could only come in, let's just say 1 time a week for 1 patient only. All right, let's just say that's a pretty extreme, okay? But that's your restriction. You have to live with that. So what are you going to do with the rest of the week with the rest of the patients? You got to figure out the virtual system. Like Cody said.
How do you set up the virtual system? I mean, say I want to talk to a patient, Marty, you know, how do I set up an appointment with him to get on a Zoom or on a House Party or whatever?
So Irect Therapy could help you set that up, but between you and that patient. So you would contact Scott and say, hey, you know what, why don't we do a Zoom or House Party and stuff? If the person goes, I know how to do that, right? Then you guys just connect. You don't need anybody's help. But if you say, hey, let's do House Party, then maybe Cody could help you guys set it up. Maybe our staff could help set it up. We have to keep utilizing every services out there to do. So I would say don't be afraid to reach out to your colleagues and find out what they're doing. This is a good time to learn those things. I mean, this meeting alone, I didn't even know House Party, so I wrote it down to pass it on to my staff. You know, but keep learning like this, because that's going to be the new norm. And we have to kind of utilize the best things that's out there for our people. And I'm so glad you guys are thinking of our inpatients that doesn't have a lot of contact, but the restriction may be still there, and we have to find other avenues to it. It will be bad if we wait to think that we're going to go back to the pre-COVID time era. We're not going back to that era again. That's not going to happen. So it's best to start prepping. Hope that helps. Okay. Does that make sense, guys?
Yeah. Is there any preemptive things that you guys are going to be doing when someone goes, let's say for an annual, or you have to see them? Is there going to be any like temperature checks? Are you guys doing any testing for COVID?
Yeah. So for now, even in the near future, on all the phases, the screenings will happen.
Okay.
You guys still have to, if it's an outpatient, as of now, you guys are still coming through the east entrance of the main hospital. You're not
Okay,
coming
so
through the
you're
SCI.
not going. Okay, you're not going into SCI. You have to go through the main entrance.
For now, right. Once I
Right.
get approval to do our own screening, then you guys will notify you guys, hey, our downstairs, you know, SCI entrance is open for you to get screened. Then you'll come through there. But right now, that's not authorized yet. They're still doing very strict control point on the east entrance. Yeah.
Gotcha.
So any changes that come out, I'll try to pass it along to like Scott or Kevin to make sure you guys pass on to you guys.
Okay.
Right. And I
Yeah,
think
we
this thing helps too. This weekly.
Right. We could even post if they change the rules. We can even update that on our website.
Mm-hmm.
You know.
And definitely through these weekly stuff, I'll keep passing stuff on.
Okay.
Right? So very good
Sounds good.
questions, guys. Good questions. All right. You guys all look like you're about to pass out on me. You guys all good?
You look tired than most of us.
Way too much medication. I need to cut them all down.
No, not yet. No. Not yet.
Must be a glare on your screen and you're just seeing your own reflection. That's what it is.
Yeah, see, we can't even see your face, Dr. Lee. You're in the dark.
Yeah, I put it on dark on purpose so you can't see me. Let's see what other things are happening. From our inpatient standpoint, new change that come out, guys. SCI Center, ours, will not take any COVID positive patient on our ward. That includes even asymptomatic. In the past, because we were able to figure out an isolation, you know, a wing could be isolated by closing our fire doors, we were willing to take asymptomatic COVID positive patients. You know, they don't have any symptoms, they just tested positive, right? But we have decided, our leadership has decided that we're not gonna take that chance with any of our SCI patients. So anybody that tests positive but needs hospitalization, but has nothing to do with COVID symptom, they're gonna go to the COVID ward on the 6th floor in the main hospital, okay? So that's actually the new change now. We are setting up a sleep study back again. We're putting in brand new machines up there. Yes, there's a risk of, you know, those outpatients coming through our inpatient ward, right? But we have 5 mitigation plans to minimize the exposure too. So there's a lot of planning process going on right now with all this. And then what does the new norm look like? We're making different changes because of the new norm.
So the $1 million question is,
I don't have it.
how soon are you going to roll out a test for a lab that we can be tested that will confirm or deny if we've already had this and we've gotten over it and we're so inoculated from 25 years in the military that we can't catch anything?
That's my bet.
I'll up the ante. $5 million question.
Okay.
It's the same question to you. Bottom line, guys, that's something we all want. We want to know if there's a way to test it and know we got an antibody or not. But, you know, who knows? Maybe we'll never get that type of answer. Maybe this would become, in a year or two, it may just become a regular flu that we deal with every year, except we have vaccinations to deal with that we can counter it with, right? But until then, this is a very dangerous virus, right? But when it's designated as a regular seasonal flu that we're going to deal with, well, because we have the vaccine to do it with it or some treatment that goes with it, until then, that answer, $1 million answer, is actually a $5 million question. So good one, but that's how it is, guys, at this point. No answers to that. Okay. In the near future, there will be a way to get you guys tested without you guys coming into the hospital. They are processing and looking at a setup of a drive-through testing. Doctor has to order it. It is a schedule, but you don't come into the hospital. You stay in the car, and they can test you. So that's coming soon, all right? As soon as that comes up and it's ready, I will let you guys know, and we'll let the doctors know too, so they can put in an order.
I think everybody should go get that test. That's a lot of fun to get that thing stuck up your nose.
Absolutely. It's not fun to get it up there.
I think the guy was touching my eyeball.
Actually, if they did not touch your eyeball and went into the brain, or when they took the swab out and there's no brain matter, they didn't do it right. That's how they explain it.
It was rough.
Aren't those tests already being done in like West Dallas at State Fair Park by the 128th?
Yeah,
Right,
there's
so-
a bunch of different sites right now,
Right.
Scott.
The governor has started investing more money into these free testing, so you can always go to that as well.
Okay.
Yes.
How do we get those results into the VA system?
Exactly. So once you get that, ask for a hard copy thing so you can either take a picture or scan it and send it to us so we can put it in our record.
Okay.
All right. That's important when you talk to your members. If they went and got a free thing and they said, hey, it was negative, I still want to get the negative test results so we can record it as well. It's very important. Okay. Definitely positive, we want to know. Okay. Every testing site has their way of notifying you how it is, but if they contact you by phone, you should be asking, hey, can you send me an actual hard copy of that, either via email or through mail, okay? Okay. Anybody gone through those free testing yet?
Yeah, I went the other day in the emergency room. I had mine.
Okay, well, your emergency room will be in, is it our emergency room, VA?
Yeah, right.
Yeah, so yours will be already in our record system. It's the ones that you go outside of the VA and get tested. We like to get that hard copy of it so we can record it. Yeah, it's not that we don't trust you guys, but.
I'm gonna say, do you recommend that we go get tested?
I think, you know, for your own sense of mind, especially you say you got a little kid in a, right, stuff. I think if you can get to the free test site and get tested, yeah, because the state does one, and the U.S. in general wants everybody tested at one point. So I would go test it if there's an area you can go.
Should we get everybody tested in the household, or should it just be the veteran?
Well, for the VA one that we're setting up, it'll be for veterans only. So if you want to test everyone in your family household, it will be these free areas to do. And more free areas are popping up, actually. So I think that's good. More people are getting tested as well. Now, something for you guys to know, as more people get tested, you'll see these reports saying, you know, more positives are coming out. Well, that's because there are more tests being tested. So it's not a sign that we're getting inundated all of a sudden with sick people. All right, just keep that as a balance.
The only curve we're interested in flattening right now is the one above our belt line that we've inherited during this quarantine.
Too late. Too late. Way too late.
Yeah, I'm trying to avoid that.
And, you know, for me, this concerns me. You know, you guys all know how I like adaptive sports, right? So we don't even know in the future what this will look like. I'm involved with a lot of different organizations. They're asking me my advice on what to do with the, you know, return to practice, how about tournaments and stuff. I'm trying to give them as best guideline as possible, but there isn't a whole lot, you know. All these big NFL, you know, NBA, you know, USOC, they all have money, so they can say, we're going to test everybody before coming in practice. Well, small organizations, there's no way we can do that. They're like expensive tests, right? So it's not that easy. And also, just because I tested you guys 3 days for practice doesn't mean a week later you're still negative. You could have come in contact with somebody and you could have been positive right after the day after you got your test done. Right?
And
so
if you're,
there's no guarantee.
If you were positive and then you test negative, then you should be good then, right?
Well, that's what you would think. However, not right now, there are a lot of people who are tested positive, tested negative, and retesting positive again. So what does that mean? That means there's no immunity. They're getting the virus again. Maybe they're not sick, but they got the virus again. So this is one of those viruses that is really weird. It's not taking your typical process.
Well, the news yesterday is that they came out and they said on that positive test, though, that the virus that they were shedding was not live. So that was hope that it wasn't an immunity. So
yeah,
I think more to come on that.
Yeah, I don't think scientifically that's what's been proven yet.
Dr. Lee, how are we doing on the COVID-19? Are we past the curve or just?
So we are on a downward curve, but like I said before, our downward curve is going to be a long stretch. It's a long tail. It's going to go well into December. Yeah, even maybe next year. So we have to keep preparing for potential surges and keep protecting ourselves just so you don't become part of the surge. You know, especially you guys. Sound good? All right. So guys, do we do an update next week, or do you guys want, is there particular people you want to talk to, or do we take a break for, you know, after for the holidays, holiday coming up, taking people going on vacations and stuff?
Personally, I would like to see us stay in contact, especially now that Wisconsinites are getting out there and becoming more active. I'd like to see what kind of results are coming in. If we're getting, we know that we might see more A positive results as far as people having the virus. Mm-hmm. But I'm more concerned about who's coming in the hospital, being hospitalized, and what are those numbers?
Sure. In terms of you know, our COVID positive patients, we only have 10. None of them are SCI, and they actually been very stable. We haven't gone up in numbers at all. We're actually people are testing negative to be discharged. In order to be discharged, they have to have 2 negatives within 24 hours. All right. So Dale, if you came in, you were sick for about a month, and then you're positive COVID, and then we test you and said, oh yeah, you're ready to go home. You're tested negative one time, and then 24 hours later, we test you again. That test also has to come out negative, 2 consecutive negatives. Then we say, hey, you can go home. But sometimes a person tests negative, and then their test re-positive again. Then we can't send you home. We have to figure out other process and wait a little bit more. So a lot of the 10 patients are in that phase. Maybe not, maybe half are in that phase right now. They're ready to go home, but they're just not tested negative yet.
Well, what causes that? Is that because that the testing isn't as 100% as accurate as we want it to be, or what?
That could be one theory. Everything's theoretical. It could be that virus is just hanging around and it just got caught on that tip.
Okay.
You know, and then it's just not virulent, but it's still testing positive. Or did he just get reinfected?
Sure.
From somewhere.
And they only test one side, and they didn't test the other side. Is that a normal? I mean, how do they know that the stuff isn't on the other side? That
yeah,
you know,
I don't know. Mine, when I got mine tested, I got it both nose. Yeah, both sides of the brain came out. So, so I'm not sure. Now, my test was very different test than what you got. What you got is a rapid test in ER. Mm-hmm. That one is really up into the brain. Mine was just tip of the brain, just kind of a booger plus, you know. Yours was brain plus. I don't know how else to explain it.
This is going to play well on YouTube.
Yeah.
You guys are killing me.
You're not making it
probably good that your
face
is shaded.
So for next week, guys, why don't we do it with me again? Because our phase opening will happen June 1st. So if I get any more updates and stuff, maybe I can keep you guys going with me until the actual phase opening happens. So next 2 weeks, why don't we stick with me so I can keep doing these Q&As for you guys.
That'd be great.
Yeah? Okay. And if things come up that I think, hey, I'm going to bring in this person to talk to you guys, I'll suggest that too.
The good overall is helpful.
All right. Yeah, I mean, I enjoy talking to you guys, so this is nice. Yeah, I miss you guys, actually. Yeah, Troy, too, you know.
I miss our sport.
I'm going to say that since he's just looking at me from his couch.
What time is dinner, Dr. Lee?
Dinner? I don't know. My wife is mad at me, so dinner is kind of frozen. Microwave.
Frozen.
Yeah, be nice to your wives. I'm finding out you got to be nice.
Hey, will that open up today?
Huh?
You're just figuring that out
today.
Is the vet opening up today?
Full vet on Grange and 27th. The Vietnamese.
Oh, the Vietnamese food place.
Yeah, they open up today.
No, I won't be visiting any place to go eat, man. I'm not taking no risk. The last thing I need is bring something positive and then wife just gets more mad. Yeah, right. All right, guys. I'll see you guys next week.
Thank you.
Here.
Okay,
All right,
thanks,
stay
Dr.
healthy.
Lee.
Don't move.